Think your Medicare plan has you completely covered? Well, Medicare can be great coverage. It's very affordable. It's great that you have access to it as you turn 65. But there's some routine healthcare items that you get on a regular basis, actually 5 routine items that Medicare is not going to pay a dime. Hi, I'm Erika Smiley with Medicare School. I'm one of the lead educators here, and I want to show you the smiley side of Medicare. It doesn't have to be stressful, it doesn't have to be confusing. In this video, we're going to talk a little bit about the 5 routine items that you're probably getting on a regular basis that actually aren't covered by Medicare. They're not going to pay a dime, and I think you'll be really surprised by the last thing on the list. So the first routine item that Medicare won't cover are routine eye exams and contacts and glasses. So if you go to your local vision center every couple of years, you get new contacts, you get new glasses, you get eye exams, this is not going to be covered by original Medicare. It's also not going to be covered by a supplemental plan. But this is something that we all need, right? We have to have our vision coverage. So what are a few of the exceptions to this? So if you have to have a cataract surgery, of course that cataract surgery is going to be covered by Medicare, and they're also going to get you 1 pair of glasses and lenses, so frames and lenses, or a pair of contacts after you've had that cataract surgery. So it will cover the 1 pair of glasses or contacts after cataract surgery. Now, if you have diabetes, Medicare will also cover a diabetic eye exam to look for diabetic retinopathy. So that's where high blood sugar levels can damage your eyes. It can lead to blindness. So they will do those kind of eye exams. You just need to make sure you go to a physician who is licensed in that state to do those kind of eye exams. That can be an optometrist or an ophthalmologist. And then the last thing you may be surprised is the prosthetic eyeball. If you would need a prosthetic eye, you can get that covered through Medicare. Now, so what should we do? All the rest of us who don't fall in these categories, we just need regular contacts or vision exams once a year. There are a couple things you can do. So if you have a Medicare Advantage plan, that's going to come with vision perk built in. So there is a vision benefit that's with those Advantage plans. Now, if you have a supplemental plan, it's very simple. Supplemental plans do not give any vision coverage, but we talk to people all the time. We sign them up for a separate standalone vision plan, and those are very inexpensive. They could start around $10 and up a month. You have a big choice of a lot of different eye doctors you can go to. It's going to give you coverage usually every year for a routine eye exam, every 12 or 24 months, depending on the plan you get, for contact lenses and glasses. So there are options to get you covered for your eye care that you need. The second routine item that Medicare won't cover are hearing aids. So a lot of us as we age are going to need hearing aids, and the average cost of hearing aids can run anywhere from $2,000 upwards of $7,000. So obviously it depends on there's different models and levels of how nice these hearing aids are, but they're expensive. So Medicare will not cover hearing aids, but what are some exceptions? They will cover non-acute hearing conditions. So something where you're losing your hearing over a long period of time. If the doctor orders it, they will give you diagnostic and balancing hearing exams for your hearing. Also, they'll cover any diagnostic services that have to be treated with surgical implants. So if they're implanting something like an implanted hearing device, that will be covered by Medicare. But just your regular routine hearing aids, there is no benefit with Medicare for those. So again, what are your options here? Well, if you have an Advantage plan, again, a lot of those have a hearing benefit included in the plan. It can have a copay. I've seen anywhere from like $125 up to like $2,000 of what your copay could be for a hearing aid. So the benefit you get for hearing will depend on the Advantage plan you're on. So that's something to keep in mind every year if you shop Advantage plans, and that's important to you. Look at what that hearing benefit is. Now, if you have a supplemental plan, what can you do? Again, supplemental plans, they're excellent, comprehensive coverage, but they're not going to cover hearing aids. So you can buy a separate standalone plan. A lot of times these are wrapped in with a dental plan. So it'll be called dental and hearing. There's a hearing benefit where it'll give you a certain amount of money that you can use towards a hearing aid. So there are ways to get coverage for something very important that we may need as we age. The third routine item that Medicare won't cover are dental exams. So this is interesting because there was just a survey done of people 65 years old who are aging into Medicare, and they said that the number one most important thing to them in coverage was actually a dental plan. So it's interesting that Medicare is not going to cover things like routine cleanings and fillings and crowns and even dentures and implants, okay? So again, something very important as we age, we need those dental services. So there are a few exceptions. So let's look at those. First of all, it's going to be if you're admitted into the hospital for an inpatient dental procedure, maybe because of an underlying medical condition or just because of the nature of how difficult the procedure is. So I don't hear of that often. I think that's not super common, but if you have to go in the hospital inpatient to get the dental procedure done, Medicare will cover that, okay? Also, again, if the dental service is needed because you're having another procedure done. So again, an underlying medical condition. So let's say a heart valve, maybe you're having a bone marrow transplant or even an organ or kidney transplant. They may cover that dental work before. They just want to make sure there's no infection anywhere and you're good to go before your procedure. The next thing that will be excluded from this is pre-cancer treatment. So if you're getting ready to have chemotherapy, same thing. If you have an infected tooth and you need it extracted or you have some kind of dental problems, they may cover that. Medicare may cover that if you're about to start cancer or chemotherapy treatments. Also, if it's a complication of maybe a head or neck cancer, then possibly the dental service would be covered. And then really the last exception here is if you have end-stage renal disease. So if you have end-stage renal disease and you're getting Medicare-approved dialysis, they may approve some dental treatments, again, before or during the time when you're about to have your dialysis done. Now, don't worry, there are things you can do to get coverage because, again, we just talked about this is really important to a lot of people who are aging into Medicare. They need the dental coverage. So just like with vision and hearing, if you go the Medicare Advantage route, then you do have that dental coverage included, okay? So there are some restrictions to that. You need to usually see a dentist who's in network. You're gonna pay a lot more if it's out of network. So you wanna just check that that dentist is in network and just check the benefit amount. So the Advantage plans are all different. One may give $1,000 a year towards dental, another may give $2,000 a year. So that's something you can shop around with those Advantage plans just to see what kind of dental coverage you're getting. Now the other route, if you're going with a supplemental plan, and supplemental plans can be such comprehensive coverage, there's a lot of benefits to going with a supplemental plan, but then a lot of people think, well, it doesn't have the perks. It doesn't have the perks of the Advantage plans. I want my dental, I want my vision, I want my hearing, right? But there's things we can do. We can add a standalone policy. And I talked about hearing, how a lot of the dental plans also have a hearing benefit included with it. So the dental plans, they start usually anywhere from $25 to $50 a month. They'll get you some pretty comprehensive coverage. So there are options for you to get this coverage, even though most dental routine services are not covered by Medicare. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. The fourth routine item that Medicare does not cover is a routine physical exam. And this would really surprise me because of course you need a routine physical exam, right? It's not that they don't cover this, it's just kind of set up differently. So with Medicare, when you first come into Medicare, you're gonna get what's called a Welcome to Medicare visit. So this is within the first 12 months. You have access to this Welcome to Medicare visit. And really, it's gonna be a conversation with your healthcare provider about your health, right? So they may ask about your height, your weight, look at things like your BMI. They're gonna ask you questions about things like depression and your mental health. They may look at what vaccines you've had and what medications you're on. They also look at things like, substance abuse. Do you have access to healthy food and things that you need? So it's really gonna be an overall review of your current health situation. And then if you need anything from that, if you need labs done or tests done or diagnostics things done, the doctor can then order those from this initial welcome to Medicare visit. So if you have Medicare and you didn't know about this, it's a benefit provided to you. So you should take advantage of this. This is within your first 12 months of being in Medicare. Just schedule that with your doctor. Now, if you're beyond the first 12 months, you get a yearly wellness visit. So again, it's more of a conversation where they're going to talk about your current health, talk about if you need to go to any specialist. They can give you referrals at that time to go to specialists. It's going to look again at things like your overall well-being, both physical health, mental health. Are you getting the vaccines you need to get? How are you doing as far as your living situation and things like that? Now, it's important to know, don't feel like you cannot go take advantage of those yearly wellness visits because you never got the Welcome to Medicare visit. It's not required that you had to have done the Welcome to Medicare visit to go get that yearly wellness visit after 12 months. So again, this is really important. Medicare is all about preventative health, right? Taking care of your health, doing the vaccine, doing everything you need to do just to make sure that you stay healthy. So if you haven't yet, or if you're coming into Medicare, just know you'll have that Welcome to Medicare wellness visit, and then you continue to get those every 12 months after. So the fifth routine item that is not covered by Medicare, and this one, it's not that it surprised me, but it's concerning, and that is long-term care. So if you would have to end up long-term in a nursing home facility, Medicare does not cover that at all, and this can be a huge expense. So seniors are living longer, but the cost of being a senior has never been higher as far as the care that you need and what that costs. So the average cost of a nursing home is $9,733 a month. That is a very high price tag. That's like higher than the highest mortgage payment that I know of any of my friends, right? So that's a lot of money to pay, $9,733 every month. And if you end up in long-term care, you don't know how long you're going to be there. Are you going to be there for 6 months? Are you going to be there for 5 years? And what's going to happen if you can't pay for this? And again, 25% of all seniors are going to need long-term care. So this is actually something I'm dealing with right now. My parents are 85 years old. They're not in good health. They're falling. They're in a 2-story house with a basement, and I need to get them in some kind of assisted living or a facility. And we're just now starting the conversations. How are we going to pay for this? What if they're in there for 5 years, right? So my brother and I are actually having these conversations right now. Many of you have probably just gone through this with taking care of aging parents, or maybe you're going through this right now as well too. And they never thought of getting a long-term care policy. So there actually are policies and plans you can buy that are long-term care insurance. And my parents didn't do that, but not to their fault, right? It's not something a lot of people want to think about, but I know my parents would never want to put financial burden or stress on our family either. So what can happen if you don't have the money to go into a nursing home? I actually have a friend of my mother's, and she's about 90 now, and she lives on her own. But when they were 70, her husband had a fall and he had to go into a nursing facility. So she was great. She was still living at home on her own, and they paid for it as long as they could. They drained their savings account. They paid for it as long as they could. Family helped out, but they got to a point where they had to go on Medicaid to pay for that nursing facility for him because his wife just couldn't take care of him at home. And it's sad because, you know, it's great that Medicaid is there and it will pay for this, but she had to get put on a fixed income. I think they let her do a few things to her house, maybe get a new car before they put her on this fixed income. But it was really she had to change her lifestyle because of this. So it's important because a lot of people don't know Medicare does not cover long-term care. Unfortunately, if you do end up in assisted living or a nursing home, you've got to pay for that out of your own savings, or if you have to have family that can help pay for that. And it can just really put a lot of stress and strain on families that's already a sensitive time that you're going through. So we actually, at MedicareSchool.com, we specialize in Medicare. We don't do long-term care here, but we partner with a company called FFIG, and they're fantastic. It's a lady named Nancy and her team, and we actually partner with them to help people with things like tax planning as your retirement, retirement as you age, when to take Social Security, things like just retirement planning in general, and they can help with long-term care plans and policies. So hopefully you'll call us for your Medicare needs, but when you talk to one of our guides, if you don't have long-term care set up, that is something you need to think about because it's not covered by Medicare. So just say, hey, Erika Smiley told me there's a lady named Nancy and a team, FFIG, can you help me out and connect me with them? And just like us, they're always happy to give you free advice and steer you in the right direction.